Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Paget's disease of bone. Introduction. Paget's disease of bone is a condition that causes too much bone removal and replacement. This causes bones that are weak and too large. Paget's disease of bone can cause pain in bones that are easily broken. It can also cause hearing loss and headaches. This program explains Paget's disease of bone. It talks about the symptoms and causes of the disorder. It also explains how Paget's disease is diagnosed and treated. Anatomy. Bone is a living tissue. It is made up of osteoid tissue, fibrous tissue. Osteoid tissue is compact. It forms the hard outer layer of the bone. Fibrous tissue is thread-like. It covers the outside of the bone. A tough and flexible tissue called cartilage is found at each end of a bone. It acts as a cushion. Many bones have a space in the middle. This space is called the medullary cavity. Bones are also made up of bone marrow. Bone marrow is a soft and spongy tissue. It is found in the center of most bones in the medullary cavity. Bone marrow contains cells that create red blood cells, white blood cells, and platelets. Symptoms. Many people who have Paget's disease of bone do not have any symptoms. The most common symptom of the disorder is bone pain. Paget's disease can cause pain in the joints, head, hips, legs, lower back. Paget's disease of bone can cause bones to be weak or deformed. This can lead to bone fractures. When Paget's disease of bone affects the small bones of the inner ear, it can cause hearing loss. Paget's disease can also cause headaches. Other symptoms of Paget's disease of bone include bowed or curved bones, muscle weakness or pain from pinched nerves, damage to cartilage, which can lead to arthritis. Bones affected by Paget's disease contain more blood vessels than normal bones. This can cause a significant loss of blood when the bone is fractured. In rare cases, this can lead to congestive heart failure. This is because the heart has to work harder and pump more blood to the bones. Rarely, bone cancer can happen in people with Paget's disease. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Causes. There is no known cause of Paget's disease of bone. People with a family member who has Paget's disease are more likely to develop it than people who do not. Some healthcare providers believe that Paget's disease of bone can be caused by a virus, but this has not been proven to be true. People older than 40 are more likely to develop the disorder than younger people. Men have a greater chance of developing Paget's disease than women. Diagnosis. To diagnose Paget's disease of bone, your healthcare provider will perform a physical exam. He or she will ask you questions about your personal and family medical history. Paget's disease of bone is usually diagnosed with an X-ray. An X-ray can show if your bones have signs of Paget's disease, such as bowing or enlarged bones. Paget's disease of bone can sometimes be discovered through a blood test. Paget's disease can cause high levels of alkaline phosphatase in the blood. An alkaline phosphatase blood test can often diagnose Paget's disease. Urine tests can show signs of bone decay. They are sometimes used to diagnose Paget's disease. In cases where bones cause pain by pressing on nerves, an MRI may be used to determine the best way to treat the problem. Your healthcare provider may use a bone scan to see which bones are most affected by Paget's disease. Treatment. People with Paget's disease of bone that have no symptoms often do not need treatment. Medication may be used to treat Paget's disease. Anti-inflammatory drugs, such as ibuprofen or naproxen, may help control bone pain caused by the disease. Biphosphonates are drugs that can help stop bone loss. These can be taken by mouth. They can also be injected. Calcitonin is a hormone made naturally by the thyroid. Calcitonin may be prescribed when someone cannot take biphosphonates. Sometimes medication is not enough to treat Paget's disease of bone. In these cases, surgery may be necessary. Surgery can be used to treat bones that are bowed or deformed, fractures, damaged joints, nerve pressure. People with Paget's disease of bone must be careful to prevent trips and falls. Using handrails or a cane and removing cords or slippery floor mats may help prevent falls that could lead to fractures. A healthy diet and regular exercise are important to keep bones strong. Taking calcium and vitamin D may be needed. People with Paget's disease should talk to their healthcare providers about the right diet and exercise plan.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Bone is a living tissue. As old bone cells die, they are replaced with new bone cells. This process is constantly happening in our bodies. Paget's disease of bone is a condition that causes too much bone removal and replacement. This causes bones that are weak and too large. Many people who have Paget's disease of bone do not have any symptoms. The most common symptom of the disorder is bone pain. Paget's disease can cause pain in the joints, head, hips, legs, lower back. There is no known cause of Paget's disease of bone. People with a family member who has Paget's disease are more likely to develop it than people who do not. Paget's disease of bone often shows no symptoms and does not require treatment. Medication, surgery, and diet and exercise are sometimes used to treat the disorder. Thank you for using Explain.